a year ago. And it is just so exciting to be sharing initial findings and to have such a gathering of those who have engaged and who are interested in developing this agenda collaboratively and openly. So let me just go over, I will be doing a few introductory slides, and then we'll be jumping into the thematic group discussions. Let me take you to the agenda next. Fantastic. So this is what we have planned for the hour. We know many of you are in many other Zoom calls throughout the day. So although we have a lot to discuss, we thought it's a packed agenda, but the way this is our proposed way of handling the call today. I will be doing a brief overview, and then we will be going into breakout groups. And then I will explain how those breakout groups will function. We have 5 thematic themes. Gender and COVID is a very expansive agenda, and there are specialist communities, and we wanted to speak to those different constituencies. And therefore, at this stage, we broke up the endeavor into these thematic groups to have further depth into the initiative. So we'll be spending half an hour in these thematic groups where there'll be brief presentations of the work to date, some of the emerging priorities, but also a discussion. We have an incredible lineup of discussants who will be sharing their experience and their perspective informally of what they see emerging and what are next steps. There'll be an opportunity to ask questions and provide inputs, and then we'll be coming back into plenary. We're extremely excited to have Dr. Ana Maria Henao Restrepo from WHO Geneva, from the COVID-19 Research Roadmap, to be also speaking with us on how we link up with that initiative and what are the opportunities together. And then we'll close out. Pascal Elotti, the director of IIGH, will have some concluding remarks based on what Ana Maria shares. And then Arinjay will just have a brief update on how to stay in touch. Can we go to the next slide? So it would be great if we have 98 participants. If in the chat room, just introduce yourselves so that we get a sense, 99 of who's in the room. And please keep yourself on mute to avoid background noise. I think speakers, we have people from all over the world. So I'm going to ask, unless you're speaking, perhaps keep your video on off to improve the bandwidth connection to those areas of the world that have limited bandwidth. You're welcome to put in questions in the question and answer function toolbox, and we'll be monitoring that. And if you, ideally, you should see at the bottom of your screen the breakout rooms, which we will move into after this introductory presentation. At the end of that half hour, we'll come back into plenary. If you can't, if you don't have an updated Zoom version, not to worry. Vidya is there in the background, and she can allocate you to a breakout room in case you don't have an updated Zoom connection. So great to see the introductions rolling. Let me keep going. We have a formal introduction of some of the those of us who are speaking. Next slide, please. So we have, as I mentioned, through a collaborative process, we decided on 5 thematic areas. We felt very strongly since, as I said, gender and COVID is such an expansive set of topics and issues. So we worked through getting input through the discussion board and through Google Doc and through a webinar on shaping these 5 thematic areas. So we're delighted to have Claudia Abreu Lopez from IIGH, facilitating the discussion with thematic group 1 on health status and behavior. Professor Geeta Mishra from the University of Queensland will be presenting. She's part of that group very briefly on some of the initial findings. And then we have Dr. Tina Purnat, who is part of the European CDC, but joining WHO. She's an expert on infodemiology, infodemics, and I remember from the roadmap convening that she had one of the most exciting presentations. So it'll be a terrific discussion, I'm sure. For thematic group 2, we have our very own Dr. Lavanya Vijaysingham from UNU facilitating that group, and really excited to have Dr. Jeanette Wolfe from the University of Massachusetts Medical School Bay State here with us. She has some amazing initiatives reaching out to the medical community, bringing them up to speed on sex and gender, including games they can play so they get oriented on sex and gender. So we're really delighted she's there. And Shireen Haidari, who is part of Gendro, but is speaking because she co-authored a paper on gender, sex and gender in this area. And we're delighted to have her here as part of the discussion. For thematic group 3, we have our very own Pascal Elodi, the director of UNU, and we have Dr. Sedi Hosseini Jebeli from the Iran University of Medical Science presenting the emerging findings. We had hoped to have Jeanette Vega, who Dr. Vega was in touch with me up until last night. This is the reality of our work. She is down with some symptoms and therefore is not well enough to join the webinar. I think in the year we've been working together, so many people have been directly affected by COVID and has caused so many uncertainties. But we will, there will be other ways in which she can contribute to the agenda. Mamatena Motupi will be from UWC will be presenting some initial findings from the paper in her place. Next slide, please. And I'm going to keep an eye. I have to speed up so that we have time for the breakout groups. For group 4, we have Michelle Remy from UNU facilitating the group on social determinants of health. Atria Mir, who has been part of that group, who's a specialist in gender diversity and working in humanitarian settings as well. And then Professor Mark Tomlinson from Stellenbosch, also here from Cape Town, who has an esteemed research trajectory, but is also working with the SBRI Research Prioritization Initiative. I will be in group 5, and I'm delighted that Mbato Motsamai, who's a colleague of ours, will be presenting, and that we have Agnes Suka on the line. She's a tremendous experience in health financing, but also was in charge of health financing and governance at WHO Geneva, and is currently at the French Development Agency. So that's the lineup today, apart from all the introductions in the chat function. Let's keep going. We have, just to briefly say, what is our overall aim? I won't spend too much time on this. We felt very strongly, this started a year ago, and we felt very strongly that there were many calls for advocacy, many calls for research on gender, sex and gender in COVID-19, but very limited actual evidence. And the work by Sarah Hawkes' team at Gender 1550 has highlighted the limitations in data sets as well, that we don't have enough information. So we wanted a way in which we could systematically set research priorities and do so in an open way, that it includes researchers, of course, but also other stakeholders, civil society members, donors, and to do it in a truly global way. And I think as much as COVID-19 has brought its challenges, having an online way to open up these discussions is really critical, so that it's not 50 people in a room in London or Geneva setting these priorities. This is done in consultation with many other groups, and we're looking forward to continue those conversations. So it's not a standalone initiative. It is something we've had a couple of meetings already with other groups, and we look forward to engage with all those that are in this space setting priorities. Next slide. So just a shout out, it's not just me alone. I've introduced others in the team, but I'm really delighted to be able to work collaboratively with so many across the globe that are contributing in different ways to shaping this research agenda. Should we keep going, Arinjay? This is a slide some of you might have seen on social media. Given time, I won't spend too much time on it. But just to say, we started last August. It's a 1-year anniversary since we kicked off stakeholder engagement. We had, in the first few months, over 400 people join from largely LMIC settings, and that's still a strong feature of our work. We've developed the research protocol in an open way and then had online discussions as the drafts developed, and we are now in the middle of getting responses for the thematic surveys. And we will have a way of bringing this to a close. I'm going to keep going because we're going to revisit this at the end because I know we're short for time. So a sense, we have already 111 responses, which is really exciting. So although we've engaged with people in many ways, we still need to get them to spend time responding to the surveys. We are just releasing the French survey, and we'll be translating into Portuguese and Spanish. And my sense is that will really strengthen further engagement with West and Central Africa, with Francophone Africa, and with the Americas. Next slide, please. What's delightful is the LMIC contributions have continued. I just want to pause here, and this was a sense to explain, we have 101 responses, but the comfort zone of those working in gender and health is in the social determinants of health. And that's why we have most people have responded to that group. The focus of our Generation Equality Forum session that we had earlier was on highlighting the importance of therapeutics and diagnostics, health service delivery, and governance as core parts of a research agenda that addresses sex and gender in COVID-19. So we're hoping to get further engagement in those thematic groups. This is a brief explanation of the criteria when you see the results. We simplified, participants had to score based on whether they thought each research question, the likelihood of the potential health benefit in answering that research question, and whether it improved gender equality, empowerment of girls and women. And the impact score combines those two impacts. And then separately, we listed urgency. How urgent is this research question? Next slide. I think we have, this is the interactive dashboard where you can log on. Claudia Lopez was integral to this work. It's exciting that this will be updated once a week, and you will see how the results change. We're going to publish an FAQ that makes it easier to navigate, and we'll do a follow-up webinar and ways to explain how best to navigate the site. But it's so exciting that anyone can look at the results as they're emerging. I'm really proud of this. Next slide. So I think we'll come back to this, so I'll just to say that, as I said, we will continue. We're midway through the surveys, and we are hoping to close this process out at the end of September, the thematic surveys, and then move to overall prioritization. But I am eager for us to move into the breakout groups. Time is ticking. So I know that was a very quick overview, but it's amazing to have 113 of you here. And I'd like to invite you to the breakout groups, because we have so many amazing people on the line, and to join those discussions. So if you go to the bottom right side on your screen, you should see the icon for the breakout rooms, and then be able to go into one of the breakout rooms. Thank you very much.